Now, here's Dr. Larry.
Did you know? Let's go.
You've waited all week.
Every week, we continue to learn how to achieve a better back and ultimately better health.
Live in the WIKB studios, this is Dr. Larry.
Well, thank you, and the Flex Pastor Tim. Hello again, everybody. Okay, let's get it started. Well, as you know, every show builds on the next. Every week, we continue to learn how to achieve a better back and ultimately better health. Now, in case any of you missed it, last week we talked about anesthesia. It was an important week to be tuned in because we learned and defined about anesthesia as we age because, let's face it, it affects us differently at every stage. So here it is again. Anesthesia. It's not amnesia, but it does knock you out for medical procedures which you know about. However, depending on your age, anesthesia might be fine or cause your brain to dim like the lights on center stage. It was anesthesia as we age awareness. Surgery, let's start there. Now, in my line of work, I have this conversation all the time with patients who come in, let's say, with bad knees, bad hips, bad shoulders, rotator cuff tears, spinal stenosis, disc issues, pinched nerves, back surgery discussions. And the conversation usually goes something like this. Hey, Dr. Larry, how long should I wait? Who would you send me to? What is the recovery like? How soon until I can walk? How soon until I can get back to normal life? Am I too old for surgery? Is my knee bad enough? And the list goes on. And that's where most people's minds go. But it can also go in a different way, which I'll explain in a bit. You think about the joint, the bone, the muscle, the nerve, the pain, the recovery, the walker, the physical therapy, the incision, the scar, the appointments. But there's one massive part of surgery that many patients got to think through a little bit more while you have your brains about you. Anesthesia. And I don't mean the casualty. It's not just the stuff that puts you to sleep. It is a major medical event. It is a controlled chemical alteration of your central nervous system, your brain, your spinal cord, your breathing, blood pressure, awareness, pain signals, reflexes, your memory formation, your body's ability to wake up again and return back to baseline. And that's why before many surgeries, it's not just the surgeon that matters, it's the anesthesiologist. In fact, you could have a surgeon who says, we're ready to go. Everybody else is ready to go. But if the anesthesiologist says, no, this patient's not cleared, surgery doesn't happen. And why is that? Well, the anesthesiologist is not just putting you out. They are managing whether your body and brain can tolerate the entire event. Now, of course, as I said last week, it's not the anti-surgery show. It's not even the anti-anesthesia show. This is not me telling you to cancel your hip replacement or to avoid a life-saving procedure. Anesthesia is an incredible advance, and without it, many surgeries would be impossible. So you get that point. But here's the difference, the awareness. If you have to have such and such surgery versus I'm choosing to have this surgery, there's a difference between an emergency surgery, a necessary surgery, or an elective surgery. And as we age, that difference becomes very important. So here's the core question for you. Can anesthesia and a surgery affect the brain? Yes, especially in older adults. Now, the scientific language has changed over time, but the basic concept is the real concern. Older patients can experience post-operative delirium, delayed brain recovery, or longer-lasting brain decline after the surgery anesthesia. So said a different way, the first two things can happen and clear up. The third thing can happen and start a mental decline. I've seen it. I went over some cases last week as we went through the whole show. The American Society of Anesthesiologists noted in 2024 that delirium and cognitive decline are common complications of anesthesia and surgery in older adults. In 2026 review, they found that neurocognitive or brain nerve disorders affected roughly 10 to 50% of elderly surgical patients, depending on some various factors. Now, that doesn't mean that every older patient or elderly patient is going to have a problem. It doesn't mean that anesthesia automatically causes dementia. It does not mean you should be afraid of every procedure, but it does mean the brain needs to be part of the surgery discussion as it relates to being put out. Not just the knee, the hip, the shoulder, the gallbladder. It's the brain. So I went through the terms. In medical, everything's got to be labeled and classified. And again, like I said, the terms have these long, marbly mouth terminology to them that to you and I sometimes doesn't make sense if we just use them in our daily use. But the first term is basically the temporary condition of acute confusion or disorientation that happens after you get out of surgery. The second term means it's a decline in your function of your brain that can last for weeks, months, or even years after surgery/anesthesia that impacts your attention and your executive functions. That's discerning, humor, writing out checks, paying bills. But like I mentioned, the first two, we'll call them temporary. The third type, and there's somebody right now that I know that you would know that had this happen to them, is the delayed cognitive recovery. And delayed is a little bit of a misfire on the term there. It basically means the foggy brain after surgery, but in a sense starts an absolute decline. Now, so again, thankfully most of these are temporary. And I went through cases last week, like I mentioned, about what this happens and how it happens. And you just start to notice the person's a little off. So if you do have questions like this, don't forget, you can log on to WIKB.com, scroll down to the Dr. Larry Radio, you'll see the Ask Dr. Larry, and you can fill out a form, and for free, I can respond to a question. If you have a question about this, when I did the show before, there was a question that came in about this specifically, and I'm glad the listener asked me that. So those terms, basically, to put them into what we say layman's terms, because most families don't walk around saying grandma has post-operative neurocognitive disorder. They say she has been right since the surgery. Dad's different. Mom's confused, more forgetful. She was sharp before and now she's not. He came home from the hospital and just never fully bounced back. That's the real world language. But medically, those are the categories that we had gone through. Now, things to notice on the worst bad one where there's a steady decline. You've got to keep these things in mind. The executive functions is a great way to say it because that means balancing a checkbook, paying bills, following directions, making decisions, driving safely, remembering appointments, handling medications, understanding instructions, and how about this one? Not getting scammed. Noticing details, being able to say, wait a minute, that doesn't make sense. Those are all brain executive functions, and those things can and do get affected when it becomes into anesthesia that starts to wash out the brain, is another way that I framed it. So the goal is not to avoid a surgery. The goal is to make sure the surgery helps the person, you, and not just the part that's being operated on. There was more. However, if you missed the entire show and want to be more in the know, then log on to my website, drlarryradio.com. Hit the subscribe button, follow the links, and listen to the show. It's been uploaded now, which you can listen to at your leisure as a podcast. And here is the final point. If you are planning to have surgery at your age, just remember that anesthesia awareness is SAGE. Now, beyond that, in addition to the anesthesia, last week we learned a simple self-test for butt muscle bulk. It was another Dr. Larry Cool tool, and you can call my office for a freebie reminder just in case you're in need of a retip or a tip up. And so that was last week. Hi-ya. Now today we'll forget that monologue for a moment and keep remembering those mandatory communication skills all doctors must have, which are inquisitive listening and staying positive. Again, it often means the difference between sick and well. Also, it's another month of the year, so let's keep our biceps in gear. Tim's got the big biceps. You'll love this one today. We're going to learn a simple self-test for bicep bulk. And of course, no flexing, man. No, I'm kidding. You, Tim, are calling it out right from the broadcast booth while we crank up the tunes and I hit the center stage for the demo. However, before all that, in order to have good health, you don't need a lot of wealth. So let's flex our forebrain and put some knowledge at the game, because today we're going to talk about, hit it, Pearl.
Dr. Larry brings you another segment of Did You Know?
Age. We ache as we age, and our bodies begin to rage into a different stage, where medications become center stage. A pill for every ill, but does your body absorb it with the same will? the hidden weight of medication over time when we get back from the break. Stay tuned. You're listening to the Dr. Larry Radio Show.
Dr. Larry will be back in a moment.
Have you been addicted to a show on TV? Are you feeling glued to the screen? Stop on in at the Crystal Falls Library and try a change.
Along with all our books, we have newspapers, magazines, music CDs, audiobooks, and the largest large print book selection around. We can help you with scanning, printing, copying, and faxing needs. We have computer, knitting, crocheting, quilting, and breastfeeding classes, along with Narcotics Anonymous meetings. We are located at 237 Superior Avenue. Our phone number is 906-875-3344.
So I have one question for you guys. Are you gonna keep watching that addicting show? Or are you gonna come on down to the Crystal Falls Library and try a change?
It's DIY Power Tool Month at Jensen Aikens Hardware and Appliance. Whether you're building a deck, remodeling the kitchen, or finally tackling that garage project, we've got the power tools you'll need at the prices you'll love. Save big on drills, saws, compressors, toolkits, and more from the brands DIYers trust most. And at Jensen Aikens, you're not just getting great deals, you're getting hometown service and expert advice from people who know projects inside and out. That's Jensen Aikens in Conover, of course.
Looking for expert bandsaw sales and sharpening? Call LogWiz LLC, offering full-service sales and sharpening. Certified Wood-Mizer Bandsaw Sales and Sharpening Center, sharpening all makes of bandsaws up to 3 inches wide. LogWiz is passing along discounted rates on Wood-Mizer bandsaws. With 57 years of combined experience, LogWiz proudly serves a wide radius across Michigan's Upper Peninsula and northern Wisconsin. From hobbyists to production sawmills, need your mill running at its best? Ask about their mill tune-ups. LogWiz, full-service bandsaw sales, sharpening, and mill support, proudly serving the UP of Michigan and northern Wisconsin and always on point. Contact John today, 906-367-1919.
This is Clovis from Iron River. You're listening to Dr. Larry's Radio.
Break's over. Time to get cracking once again with Dr. Larry.
Welcome back. Age. You know at your age, you ever hear a doctor tell you that? You know at my age, you ever tell someone that? So this is a spin-off from last week's show, Anesthesia as We Age. Now it's medications as we age. Same pill, different body. Are you taking too many medications? Kind of a question to ask. Another way to say it is your body taking those medications today the same body that is handling them or was handling them 20 years ago? Or how about this, you might say, Doc, I've taken that medication for 20 years, I've never had a problem. My response would be, I understand that, but the medication may not have changed. Your kidney clearance may have changed. Your liver metabolism may have changed. Your body water and muscle mass may have changed. Your balance reserve may have changed, and now you may be taking 3 other things that interact with it. So again, it's the same pill, but in a different body. So why taking a medication for 20 years, for 5 years, for 10 years does not always mean it's still safe, because there's a hidden weight of the medications over time. So I want to give you a little theater of the mind here to tie into what we're talking about. Based on current American prescription medication use, the average person is exposed to the equivalent of nearly 50,000 prescription daily doses over a 79-year lifetime. That does not include Tylenol. That does not include ibuprofen. That does not include the Aleve, the aspirins, the heartburn tablets, the cold medications, the allergy pills, or the sleep aids purchased over the counter. When you conservatively add all this in, a very reasonable estimate is the average American swallows somewhere around 60,000 medication pills or doses over the course of a lifetime. Now, here's a part that I want to make you think a little bit. If those pills average about 0.5 gram each in a physical tablet or capsule, that's about a big bag of concrete. One way to think about it. 60 to 70 pounds of medication of pills swallowed over time. Let me even make this a little more interesting for you, Earlier, I told you that based on current prescription and over-the-counter medication use, the average American may swallow somewhere around 60,000 medication pills or doses, but that does not include the supplement cabinet. Multivitamin, vitamin D, fish oil, magnesium, calcium, turmeric, probiotic, and melatonin. Those sound familiar. The products that people do not always even think of as part of their medication load. So the latest CDC data shows that more than 60% of American adults use a dietary supplement. And among people 60 and older, that number is nearly 76%. Even more important, more than half of adults over 60 report using 2 or more supplements. So I'm just kind of throwing these into to build up the number before I make a pivot here. So we put together all of it. Reasonable conservative lifetime estimates, prescription medications, over-the-counter pills, and supplement capsules. The number is no longer 60,000. It's closer to 85,000 to 90,000 pills and capsules or medication dose units swallowed and digested over a lifetime. That's a lot of flipping pills. Now, I'm saying it because we need to reconsider and think about medications not as a small, occasional event in the body, just a baby little tablet. I put it on my tongue and I swallow it with water. I eat it with food. That's it. That's all. That's it. Or the one horse pill you have to take. I got to get that one and I got to cut it in half. For many of us, medication exposure is decades long, and there is a daily physiologic relationship. And the medication may still be the same, but the body processing is not. So the body may become less able to process, tolerate, balance, or recover from the effects of a medication that was once completely reasonable. In other words, some medications can accumulate when clearance slows. Some medications' effects become stronger even at similar blood levels. Some medications interact with new medications or supplements, and also you may be dehydrated, maybe like a cocktail at 5. Some side effects are mistaken for normal aging. So the FDA, trust them or not, doesn't matter, but it's something to throw out there as far as a quote, warns that aging can affect how medicines enter the bloodstream, distribute through the body, reach the liver and kidneys, and are broken down and eliminated. Here's something that I hear in the office all the time. I'll ask a patient, how are you doing or how are you tolerating that medication? Typically, I probably had it 3 times already this week. Oh, I've been taking that one for years. Never been a problem. But here's the part that I want to make sure that we don't miss. Again, medication might be the same, the dose might be the same, the bottle might look the same, but you are not the same physiologic person you were 20 years ago, 10 years ago, 5 years ago. Your kidneys might not clear it as quickly, or the liver. Your body may contain less ability to do so. Brain might be more sensitive to certain sedations. The balance may be less forgiving, and now you may be taking 5 other medications or things that change the entire equation. So here's the point that I'm building to, and we're going to start to highlight some case examples and what I'm talking about. Medication load is more than just your pill count. Most people think, how many pills I got to take today? I can put in my little pill thing, 7 days a week. The more sophisticated way for you to analyze it is medication load equals dose times clearance times sensitivity times interaction times loss of reserve, and I could even add a few more in those. So this isn't a literal medical calculation. It's more of a common sense way to start to wrap your mind around this. And when you hear some of the effects that this happens to people, when the medication load becomes intolerable and they lose 1 to 3 years or 5 years of their life because they're in a medication overload and it's not recognized, then you'll be like, wow, I really want to take this in more into consideration. A patient taking 8 carefully selected medications might be doing well, and another one taking only 3 might be experiencing dizziness, dry mouth, constipation, fatigue, memory fog, weakness, some balance issues, urinary problems, falls, low blood pressure, poor appetite, daytime sleepiness. So the number matters in certain respects, but the effect is what matters more. I'm going to go through 5 types of medication loading in quotation marks. So the first is the body may not be able to remove the medication like it used to. You don't eliminate as well. The kidneys are the most important organs for clearing medications. And I can hear in your back of your brain, you go, but Dr. Larry, I get my labs pulled every year, and my kidney and liver function is fine. And I'm going to say, good, but, ... hang on. So this is where you're thinking, I've been on the same dose. And I say, correct. But your body might not be removing the same amount every single time. So a safe dose at 45 is not automatically the right dose at 55, 65, or 75. For certain drugs, and we're going to go through a list of some of them, slower clearance means medication can reach a higher steady state level or remain active longer than it once did. Merck, which you've heard of that, notes that the drug metabolism and excretion often decreases with aging, and toxicity from chronically used medications can appear gradually. It's one of those things. It's almost like forcing yourself to watch grass grow versus just looking out the yard after a good rainstorm in a couple of days. Oh, if I should cut the grass. Or something else in your life where it's really hard to detect. I mean, let's just put aging. This isn't, by the way, to beat up people that are elderly. This is actually to help. That's why I'm doing a spin-off show of this. These effects are subtle and slow over time, and the toxicity begins to build that makes you think it's running parallel with your, I'm just getting old, or at my age, this is what happens. When in reality, if you clear out and discover that the medication load has become toxic, you all of a sudden feel like you've got more of the fountain of youth. That's what I'm talking about here. So again, going to my kidney blood test was normal, so I process medications normally. Not always true. Creatine is partly produced by muscle. As people age, loss of muscle mass, or become frail, or lose weight, or gain weight, etc., they may produce less creatine. This can make a kidney number look more reassuring than the person's true medication clearing reserve. You get that? So actually the normal aging process with this one lab can hide out and give you a false kidney function if you're on a load of medications. I know it's a bit of a brain teaser, but you got to hear me out on this one because it is reality. In simple terms, let's put it this way. A smaller engine may produce less exhaust. That does not automatically mean the filtration system is perfect. So for patients with substantial loss of lean body mass, I'm talking muscle. I'm not talking necessarily adipose tissue or fat tissue. I'm talking about fat tissue. I'm talking about body mass in the sense of muscles. Creatine-based kidneys estimate can overestimate your drug-clearing function. So a surprise for you. An older person can have a fairly normal-looking kidney blood test and still not handle certain medications the way they used to, especially if they've lost muscle mass, and we all do as we age. I want to give you an example of this. I'm gonna highlight this example as the case example of what I'm talking about, and you're going to relate to it. And this one's important. The medication is metoprolol. Metoprolol is a beta blocker, as many as you know. It's commonly used for blood pressure, certain heart rhythm problems, after a heart attack, and in some patients with heart failure. So let me be very clear and important. This can be a very important medication, even life-saving for the right patient. This is not about saying metoprolol is bad. This is about asking whether the person taking it is still tolerating it well. I recently had a patient tell me about her husband. He's in his 70s. He already had a lifetime of medication exposure and loading behind him. Metoprolol was added to his regimen several years ago, and over the next couple of years, he went into his wife described as a steady state of decline. Not one necessarily big dramatic event, it was just a steady state of decline. He wasn't himself. Less energy, less drive, less function, less of the spark the wife recognized in her husband. Legs were swelling. So for 2 years, nobody could really explain why. Because when someone in their 70s, when they start to slow down, they become weaker, especially if they've had some medical surgeries, they're more tired, less active, less engaged. It's easy to say, well, they're just getting older. He went to physical therapy for 6 months, cumulative, had injections in the spine because they're thinking maybe it was a case of maybe a spine because he had a lot of spinal issues. All of it, zero relief. But eventually, a sharp, tuned-in cardiologist took him off metoprolol under medical supervision. Here's his wife's quote: "He is like a new man." Now think about that. For 2 years, what looked like aging, frailty, general decline may have been in part or entirely a little bit of his body, but it's his body no longer tolerating the medication load, and specifically the metoprolol. Metoprolol is designed to put a brake on the heart's response to adrenaline. It slows the heart rate. It reduces the workload on the heart. It can lower blood pressure in the right patient. That brake is protective. But in an older patient with less physiologic reserve or less ability to handle the load of the medication or load of other medications, maybe the other medications, if he wasn't on those, he could have handled the metoprolol. So this is building on the point here. The lower activity or capacity or the greater sensitivity to its effects, that same brake may begin to feel like the parking brake is partially on all day long. The heart rate might not raise the way it needs to during activity. The blood pressure may not adapt well when the person stands up. The patient feels tired, lightheaded, weak, flat, short of breath, legs swelling, no circulation, less motivated. Quote, everybody says he's or she is declining. But the question we need to ask, because this is not just, oh, it's a one-off or a two-off. This is a more common thing that I see in patients, and it's eventually the aha moment when it's removed. And I'll get into a case that I was involved with that didn't have a good outcome. So when the patients begin to decline, and what changed in the medication lists before it began, and you sometimes have to go way back in history. This in case was 2 years. Sometimes it's 5 years or more. So a medication side effect does not always look like a sudden reaction. Although I've had that case and many of those come in where it was a sudden negative reaction. Sometimes it just sounds like Dad's not getting around like he used to. My husband doesn't have that energy anymore. Mom's weak. She sits in the chair all day. She seems dizzy, just not herself. Almost sounds like the anesthesia show we just did. In this case, it's not anesthesia, it's the medication loading. More subtle. There's not the event of so-and-so had surgery, they were put under, and now they're like this. Even that can be a little bit of an elusive cause-effect relationship. This is so-and-so's been on medication for 20 years or 10 years, and now they're like this. How are you going to roll back the clock and go, it must be that statin, or must be that metoprolol, or go on your list? A lot more difficult to decipher if you're not thinking along those lines. So, you may have normal-looking kidney numbers and still not tolerate a medication well. And why is that? Because the load is not only about whether the body can clear the drug, it's also about whether the body can still function well under the effect of the drug. You get the slice of the dice there? You get the pivot I just did? It's a bit of a trade-off. And in certain elderly patients, especially like after a heart attack, beta blockers were associated with lower mortality. It saved lives. That matters. But in very vulnerable older patients, now I don't mean frail and weak, who already had significant functional or cognitive or mental impairment, beta blockers were also associated with a greater risk of further clinical decline. And I've got about 60 seconds here. I'm going to tell you a case in similar vein, but a bad outcome. I had a guy come in, back pain, lethargic, I noticed. He had back pain and he was lethargic. And so I just kind of paused and I took his pulse, and it was a 33. Then I took it again, it was a 34. And I was like, this is not right. So I got hold in certain ways of his doctor, made mention, hey, look, he's on BP meds and seems really low. Family says, hey, by the way, he's fallen asleep at the table, just not himself, roughly maybe mid-70s. I don't remember the actual age at this point in time, but you get the point. Nothing changed, no medication profile changed, nothing was removed, nothing was added or switched to see if this was the effect. At that point in time, I can't do anything further and let the case go. It is what it is. I put it out there. I can't make a doctor do something that they don't want to do. Within 6 months of that event, the patient died of heart failure in the middle of the night. Paul said a 33, a 34 was when I grabbed it while they were still conscious. Under that, your heart is barely beating. And again, in an elderly heart, you're at risk of failure. So you get my point. The load of the medication at that point in time had a high probability that was affecting him. And if it was altered or removed, it probably would have brought his pulse back up and things would have been better. Now, there's spin-offs to that conversation that we don't have time to get into, but I hope I'm making the point. I've got some other things I want to go through, and we're going to do that. We're going to talk about distribution load, how the medication goes into different compartments of the body, the sensitivity of the load, and then the interaction of the load. So we're going to go through a couple of these things, and also one point that I really want to hit on is, and it's a fascinating point, is how medications can disguise themselves as they age and what happens as well. We're going to do that when we get back from the break. Stay tuned. You're listening to the Dr. Larry Radio Show.
We'll be right back with Dr. Larry.
Here's your Iron River and surrounding area forecast. Cloudy this afternoon with a chance for storms. High of 82. Winds out of the southwest 8 to 15 miles per hour. Lows level off around 58. Tonight, chance for storms. Cloudy skies with a few peaks of sun. Tomorrow, chance for storms. Highs around 82. From the Weatherology Weather Center, I'm meteorologist Jennifer Wojcicki on WIKB. Right now, it's 84 degrees.
Stevens Real Estate has been the top producing real estate company ever since 2009. With convenient locations in Iron River, Florence, and Iron Mountain, buying and selling real estate has never been easier. Our team of pros is your team of pros, trusted since 1979.
Your healthcare should be about what's best for you. Yet too often, healthcare professionals focus on keeping patients within their system, including who they refer you to. I'm Dr. Jason Klein, orthopedic surgeon and physician owner at OSMS. You should be seen by who you want, and you can be. At OSMS, our focus is on providing you with the highest quality of care in a safe environment. The best part is, you usually don't need a referral for orthopedic care. Learn more at askforosms.com.
I would never recommend buying a home without having the water tested first. It's cool, it's clear, it looks clean. Oh, it tastes good. Well, what's really in it? And we just recommend that you check it out. I'm Jennifer Toivonen. I'm a co-lab director at Whitewater Associates of AMISA. Coliform bacteria, lead, arsenic, nitrates, nitrites. You want to be sure that water is safe. I would recommend giving us a call. That way we can tailor the kit that we send to you for what you need. 906-822-7889. Give us a call.
Does your financial advisor take the time to really listen to you? Is your financial strategy personalized to you and your family? Will your financial advisor be there as your life and financial situations change? When you work with Ryan O'Grady, your Crystal Falls Edward Jones financial advisor, he focuses on what's important to you. You work together and use an established process to create a personalized financial strategy, backed by the advice, tools, and resources to help you reach your goals. And you can partner long-term to help your strategy stay on track. Contact Ryan today at 906-875-3833. Edward Jones, member SIPC.
Break's over. Time to get cracking once again with Dr. Larry.
All right, welcome back. Medication loading. Pill tolerance. Each age has a different stage. Call it the Mr. Pill Popper Show for fun if you want. Just kidding. But in all seriousness, back to the blow-by-blow. Medications could be in competition. When treating one problem, it quietly worsens another. So this is another somewhat sophisticated concept that you will understand once it's explained. A medication may help one condition while worsening another condition. For instance, a person may have arthritis pain, blood pressure problems, kidney vulnerability, balance difficulties, memory issues, and insomnia. A treatment that relieves one symptom may create difficulty in another symptom, and it's called therapeutic competition in a way. It's called other stuff too, but that's one way to say it. Treatment for one disease may worsen or coexist a disease or functional problem. Research in community living older adults found this one issue was common, affecting approximately 1/3 of older adults with multiple chronic conditions in one analysis. Medicine often treats one diagnosis at a time, as you heard me say at the beginning of the monologue, one pill for every ill. By the way, I got that from a primary care doctor who came in to me as a patient. She got referred in by actually a lot of you. And I said, what are you doing here? And she goes, well, in my line of work, it's one pill for every ill, and I know that can't fix my spine problem, so your patients told me I got to come see you. So primary care lady a couple of years back. And that always stuck with me because I thought that was kind of a funny, catchy way to say it, coming out of her mouth, not mine. So again, medication often treats one diagnosis at a time. An easy way to kind of understand that. Your genetics may say one thing, but your current medication mix can temporarily change how you metabolize drugs. There are a couple of patients, one of them is a Swede. When he gets put out for surgery or he's on some type of pain, narcotic medication for whatever, he's been banged up his whole life, he literally has to tell the medical staff, you must read this article. You got to understand this. If you go to put me out, if you go to give me this medication, the way that my body metabolizes it, you have to give me a horse dose. And here's why. My genetics are like that. His daughter is the same way, and I hear variations of those stories as well. Sometimes your genetics, and this kind of goes into smaller ways too. Let's say muscle relaxant. I know some patients that take a muscle relaxer and they're like, yeah, just no big deal. Yeah, no problem. Some of them, like, I was drooling on a half a pill for 4 hours. And some go, I had the opposite effect. So your body genetics can play a role as well too. And I hate to break the news, you're not being prescribed a medication based on your genetics. You're being prescribed a medication based on your diagnosis. So one pill slapped across 100 people from different genetic pools, it's going to hit you a little bit differently as well. So your genes can suggest that you normally process a medication just fine, but add another medication that blocks some type of, let's say, liver pathway, and suddenly your body may function as though it's a slow processor. And it doesn't mean, by the way, genetics will solve every type of medication issue. That's not the point. I'm just adding this to the equation and making the point bigger. Medication loading over time per your body's stage at every age changes with so many different variables that you have to be aware that it can start to quietly cause certain types of decline and other issues. So examples are the middle of the night fall. Elderly patient gets up at 2 a.m. to urinate, maybe taking a blood pressure medication, a diuretic, a sleep aid, anti-anxiety med, a bladder medication, and perhaps an OTC antihistamine. So combine that with darkness, grogginess, low blood pressure when standing, poor balance, urinary urgency, and reduced reaction time. That fall may not simply she's getting old. It might be her medication load and burden and nighttime physiology created a perfect storm. Big difference. Take all those medications out of the equation. Ethel can get up in the middle of the night and pop right in and go potty and come back. But the medication burden and loading is causing issues in the middle of the night. And that's just one example. How about a patient has blood pressure medication, a diuretic, and chronic arthritis? They begin to use an over-the-counter anti-inflammatory frequently. Catch this. The combination of that medication regimen, called the triple whammy, because it can significantly increase the risk of acute kidney injury, especially during dehydration or illness. Let's say you don't feel like drinking water. I had a lady that lives on her own, a widow. She was in yesterday. Her muscles were tightening up as I was trying to work on her. I go, what gives? Why are you so dehydrated? She's like, well, what do you mean? I go, you are dehydrated. Your muscles are cramping as I'm trying to stretch them out. I hate water. Now, imagine if she was taking a blood pressure medication, a diuretic, and a chronic arthritis pain. I know she's on a blood pressure medication. I'm pretty sure she's not on the other two, but imagine if she was. The over-the-counter pill may not look like danger by itself, but it may become dangerous when it's added as a third player in a kidney stress combination. Medication loading over time. Let's send the airplane above this show. Let's have the banner we all look up, or the blimp, and that's the banner that you're looking at. What's that blimp doing over Iron County? What's that say? medication loading over time. That's my whole point. Bogging you down a little bit in the details on purpose because it's more complex than just saying, she's just getting old. He's losing it. It could be one of these issues that needs to be solved or fixed. Again, the astute cardiologist from the patient before, the guy's got a whole new light of life going right now when everybody thought he was on decline. So that's how you need to start thinking about this. When we're younger, we have better kidney reserves, better liver reserves, more muscle mass, better balance, faster reflexes, better hydration tolerance, more cardiovascular abilities. Aging reduces these buffers. They're buffers. So as the medication regimen becomes more risky, and again, let's also state, typically, honestly, as we age, you get more prescriptions thrown at you. In the back of your head, you might say, I don't like to take pills, but if I have to, I will. Because you have been trained, we have been trained to think of medications as static. I take this pill for this diagnosis. What I'm teaching you in the remaining few minutes of the show is to think more dynamically. This pill enters a changing human you along with every other pill, along with illnesses that you've had or will have, with every fall, every kidney change, every dehydrated day, and every lost pound of muscle. That's how I want you to think about it dynamically. Of course, you know, even though I'm a chiropractor, I'm not anti-medication. Medications have their part. They control blood pressure, prevent strokes, treat infections, control diabetes, the list goes on. But a medication that was right for you 20 years ago, 10 years ago, deserves to be looked at through the lens of what I'm talking about today. Not because your doctor made a mistake, not because the drug is bad, but because the human body is not static. Good medicine should change with you, not change you. So before we wrap up the show, I want to bring this at full circle for you. Because everything I've said about medication also applies to the rest of healthcare. The same pill may not be fit for the same body 20 years ago, but neither is the same adjustment from your chiropractor. Neither is the same physical therapy program. Neither does the same exercise routine. Neither does the same assumption about what a patient can handle. So my own profession as an example, I see a patient in their 50s who has good bone density and strong muscle mass, good balance, healthy reflexes, good mobility, and a very resilient body, and I examine them, identify the problem, and treat them. If I see them 5 or 10 or 15 years later, and I've been in practice long enough now where this has happened, I don't treat them the same. That should be the standard of protocol. And I get into a little issues sometimes with people. They go, can you just crack my back like you used to? And I go, you're changed. I can't. I had to have a sit down with a nurse about her neck. She used to see a chiropractor. He would, quote, crack her neck. Oh, it was great. Gave me lots of relief. I said, yes, in your 20s and 30s and 40s, you're 60 now. That's not going to work. We're not cracking the neck. So keep that in mind as we go through this discussion that involves physical therapy. I had a patient in last week. She threw at me her physical therapy routine. She said, take a look at this. Make sure I'm doing everything right. And this was for something from a few years ago. I looked at her list. I said, these 3 are removed. You can do the rest. Came back the next visit later. She goes, it's a miracle. I'm fixed. You didn't do anything. I said, right. I just matched your age. And I said, that you can't do ever anymore at your age. You could have 5 years ago, but no longer are you able to do that now. That was actually the fix. She was doing an exercise that was actually making her condition worse. This is the whole point, to bring it full circle of what I'm talking about. So a bit of a deep dive into this topic, but also a spin-off from last week, medication loading as we age. Okay, upcoming announcements and our tip and trick of the week after the break. This is the Dr. Larry Radio Show.
We'll be right back with Dr. Larry.
As America approaches its 250th anniversary, businesses across the country are joining the celebration, not just by looking back, but by helping build what comes next. From storefronts on Main Street to hometown employers and community partners, local businesses are marking this historic milestone by bringing people together, supporting civic pride, and investing in the future. Some are hosting neighborhood events, some are spotlighting local history, and others, they're rolling up their sleeves through volunteer service and community projects. It's all part of a once-in-a-generation opportunity to celebrate 250 years of independence in ways that are welcoming, meaningful, and inspiring. Because America's 250th, it's more than a birthday. It's a chance for businesses and communities to honor the past, celebrate the present, and imagine the next 250 years together. Join the celebration, support local businesses, and be part of this historic moment. WIKB WFER is offering discounted ad packages for you, the businesses. To take advantage of this opportunity, stop into the studio at 809 West Genesee in Iron River or call Lenny Johnson at 906-296-4512. America 250, celebrated by communities, supported by businesses, inspired by the future. June is Cataract Awareness Month, and if your vision is getting cloudy, dim, or blurry, you may not be alone. Cataracts are one of the most common causes of vision changes, especially as we age. But the good news is, they are highly treatable. At Garrett Eye Center, with locations in Iron Mountain and Escanaba, they specialize in advanced cataract evaluation and surgical care using state-of-the-art technology designed to help restore clear vision. If you're not noticing glare at night, faded colors, or difficulty reading, it may be time to get checked. Don't wait to see clearly again. Call 800-428-8149 today to schedule your cataract evaluation at Garrett Eye Center.
Breaks over. Time to get cracking once again with Dr. Larry.
Welcome back. Okay, a couple of things before we wrap up the show and get to the weekly tip and trick. First, shoes. Don't forget about Queen City Running. If you need some good shoes, walking shoes, running shoes, work shoes, or just something better for your feet, knees, hips, and back, go see them. Remember to mention that you heard it on the show. Get $25 off discount. A lot of people are starting to use that as they want you to. That applies at any one of their locations because good shoes matter. I say it all the time. The foot hits the ground first. And if the foot's not supported well, the knee, hip, the back, the spine, even the neck and shoulder can pay the price. Check out Queen City Running. Get some shoes from them. Remember, they got the 7-step shoe fitting process, and they've got a wonderful warranty program as well too, where you try them out, and if they're not the right shoe, they want to make it right. It's you can't get that necessarily on an online store. They're right there in Iron Mountain. Somebody asked me this week, where are they exactly located? It's right in literally downtown. You look on the right hand side. I think it's by where the old trophy shop was. You can see their display. Queen City Running. And the reason why you're going to need some good shoes is because it's time for T-shirts. T-shirts. Run your bass off. If you want to get a T-shirt and you want to run your bass off on Sunday, July 12th, head over to Facebook or go to runyourbassoff.org. The course starts, of course, and ends in Runkle Lake Park. And you are guaranteed a T-shirt if you sign up before June 15th. Look, I know. I see the fishery hoodies. I see the T-shirt. Everybody loves a T-shirt up here and a hoodie. In this case, it's summertime. Get your free T-shirt. It's guaranteed before June 15th. That means you've got 11 days to sign up and get a T-shirt and then run your bass off on July 12th. Race day registrants receive T-shirts only as long as supplies last. There's different age groups. Start time is around 9 a.m. End time is around 12 o'clock. And they got the prices on the website. It's actually a really nicely done website, and you can help navigate through there. Don't forget to check out Ask Dr. Larry on WIKB.com. You can email your healthcare questions to me right through. Pain question, back question, neck question. You got an insurance question, I'll try. I had a guy came in for a consult, and I think the consult, which he happily paid, was about, I'm going to say $100, maybe times 2 consults, $200. He took roughly 60 minutes each time of my time, so it's about $100 to $120, let's say. So for a $200+ investment, he saved $90,000 because I told him what to do with his insurance, where he was going to remortgage his house and pay for a $90,000 procedure. He followed it. He did it. $90,000 back in his pocket. Not a bad investment for him. Here's the deal. Also, there's shows sometimes that you miss. Maybe there's something you want to hear again. Maybe you want to review something. Don't forget to check out my website, drlarryradio.com. There's 3 main tabs. The one that's going to hit you like it's a welcome, boom, and you'll see a little subscribe button over there. You can click that, hit subscribe, follow the links, and you can go through and listen to some archive shows. I just keep throwing them on there. Lenny records them for me. Tim hits the space bar to make sure he doesn't record the next 24 hours of radio, which happened, and he doesn't care. I threw him under the bus. It's a lot of data. And but anyway, what that does is it stops after the show, and then I upload it on there for you to listen to. And you'll see another spot, too, where you can hear the most recent show pretty quickly right underneath that. There's also my office hours and a way to email my office as well, too. That's drlarryradio.com. That's kind of funny, actually, by the way. Someone mentioned, I don't even know your last name, Dr. Larry. It's Lowen, by the way. Loewen. And no, I'm not related to all the Lowens, but we're probably somehow related. Somehow, some way, it seems like the Lowen name is in healthcare. There's Dr. John Lowen, as far as I know, no relation. There's Dr. Lowen, that's a podiatrist in Marquette. There's Lowens with names that are in healthcare. And at this point in time, I've never seen them at a family reunion. But in fairness, I don't go to family reunions, so I guess if they're there, I wouldn't see them anyway. But Dr. Larry, for all the rest of us, makes it simple and easy. And Hubert Tim, you ready to do some bicep flexing? You head up to the broadcast booth. I'm heading out center stage for the demo because today we're going to learn a simple self-test for bicep bulk. Let's snap into a Tim Tim. All right, here we go. Yeah, you blasted our ears, man. That's fine. All right, let's go. Take a look. All right, what am I doing?
Dr. Larry's he's flexing his biceps.
Yeah, a lot smaller than yours, man.
See, I got a question. Lindsay Lohan, are you related to her?
No, different spelling, different. Oh, okay. Yeah, that's Lohan, Lohan.
Oh, I thought you could introduce me to her.
Yeah. Isn't she living out of the country or something?
Yeah, she's dropped out of the...
You know, you get these stupid, like, things where it's like, where is this celebrity now? And they pop up in front of you, like, yeah, isn't she, like, living someplace else? I don't even know. Yeah. That's Lohan.
Lohan.
This is Lohan. Right. Or Leuven if you're German. It's got that little accent, whatever.
Oh, cool.
Yeah, there you go.
Yeah, I'm German, too.
There you go. Hey. Right. Oh, yeah. And we got our white T-shirts on today, man.
Oh.
Yeah. But mine's a V-neck. All right. Did you call it the tip and trick? What are we learning today? Well, as you heard, we lose muscle mass as we age. Muscle loss is not just a cosmetic thing. It affects strength, your balance, your ability to get up from a chair. It affects your ability to catch yourself if you stumble. It affects how well you recover from illness. And as we discussed earlier, significant muscle mass or lost mass can even make some kidney tests, blood tests, look more reassuring than the person's true medication handling reserve. So what do? Well, you can stand in front of a mirror at home, or Tim, like you just did right in the studio. Stand upright, both arms, let them hang and relax. Palms upward, forward, and flex. All right? Arms might quiver a little bit. You know, you might have some hangy stuff underneath there. Point is do you have nice, decently solid muscle bulk on both sides of the biceps, or does one arm look noticeably smaller than the other? Now, it sounds like I'm goofing around, but this is important. A case in this county, the guy, 3 years, was told nothing was wrong. I literally did that exam. I said, roll up your sleeves, flex. And I said, look how small your bicep is over there. That led to the fact that we found he had a bone spur sticking through his spinal cord, shutting off his cerebral spinal fluid to his brain, and he had to have surgery in his neck. That thing was shunting off the nerve to the bicep. So I don't just do these for fun. They are fun, though. But that's a little muscle bulk test. That one test literally discovered what his problem was. Well, folks, we got to wrap it up again. And remember, you can listen to me live right here every week to learn how to achieve a better back and better health. Or if you're having a pain or problem, I'm here to help. My number at the office is 906. And by the way, Spectrum came out last Sunday. They said the phones are fixed. Should we believe them? Try it out. 906-875-3215. Have a good day, man. The board, and I'll see you next week, everybody.
The
Northwood's home of classic rock and your favorite hits. 99.1 WIKV, Iron River, Crystal Falls, Florence. A Listen Up radio station.